8 warning signs of low oxygen in your blood. When you have low blood oxygen levels, you can experience shortness of breath and confusion. Hypoxemia is a serious health condition that requires urgent medical care. Hypoxemia is when you have low levels of oxygen in your blood. When this happens, the organs and tissues in your body don't get enough oxygen to function properly. Hypoxemia is often the result of a problem with gas exchange in your lungs, although it can have some other causes. Gas exchange happens in the alveoli, the tiny air sacs in your lungs that are surrounded by blood vessels called capillaries. During gas exchange, oxygen from the air you've breathed in passes from the alveoli into your blood and is then delivered to the cells throughout your body. While this is happening, carbon dioxide leaves your blood and moves into the alveoli, where it'll be expelled when you exhale. When this gas exchange is affected in some way, it can lead to hypoxemia. It's a serious medical situation that requires prompt medical attention. What's a normal level of arterial oxygen? Determining your blood oxygen level is an important part of diagnosing a variety of health conditions. There are different ways this can be done. An arterial blood gas (ABG) test can measure the amount of oxygen and carbon dioxide in a blood sample taken from your artery, typically in your wrist. Arteries are blood vessels that carry oxygen-rich blood to the organs and tissues in your body. Because the blood sample comes from an artery, the results of an ABG test can give your doctor an idea about the oxygen level of the blood that's currently being delivered to your body's tissues. It can also let them know how effectively carbon dioxide has been removed from your blood. How to measure oxygen? The fastest way to measure saturation levels is through a pulse oximeter, which is a small piece of equipment that is attached to a fingertip. It contains a light sensor that detects the amount of oxygen molecules circulating in the blood. Generally, healthy people will have oxygen saturation levels over 95%. This value can dip to around 93% with a cold or flu, which is an expected finding and not of concern. However, when oxygen levels are noted to be less than 90%, it can be a sign of a serious illness. Learn more about how to measure your blood oxygen levels using pulse oximetry. 1. Altitude. Places with an altitude over 3,000 m, or 1.8 miles, can increase your risk for decreased oxygen levels. The further away from sea level, the less the oxygen content in the air, making the air difficult to breathe. This is also referred to as hypobaric hypoxia. It can cause several complications like acute pulmonary edema unrelated to the heart, cerebral edema, dehydration, and hypothermia. 2. Lung disease. Changes in the lungs caused by illnesses like asthma, emphysema, pneumonia, or acute pulmonary edema can make it difficult for oxygen to enter the lungs and enter its membranes. This can reduce overall oxygen levels in the body. There are other types of situations that can also interfere with breathing, like neurologic disease or a coma. These conditions can impact how the lungs work. 3. Changes in blood composition. Anemia caused by a lack of iron or vitamins, bleeding or genetic disease can cause low oxygen levels in the body, even if your lungs are functioning properly. This occurs because anemia is associated with a lower concentration of hemoglobin on the blood cells. Hemoglobin is responsible for the transport of oxygen to the rest of the body. Therefore, with lower hemoglobin levels, there is less oxygen transported. Learn more about hemoglobin and how high or low results can impact the way your body functions. 4. Poor circulation. This occurs when there is enough oxygen in the blood, however it is unable to reach tissues or organs in the body due to an obstruction, like a heart attack. It can also happen when blood flow is weak, like with heart failure. 5. Intoxication. Situation like carbon monoxide, Medication overdoses, alcohol and psychoactive substances can interfere with the adhesion of oxygen onto hemoglobin or impact the absorption of oxygen into the tissues. These can all lead to low blood oxygen levels. 6. Neonatal hypoxia. Neonatal hypoxia occurs due to a deficiency of oxygen absorption by the baby through the placenta, leading to fetal distress. This can occur before, during or after the delivery and happens due to maternal, placental or fetal factors. It can lead to complications like cerebral palsy or intellectual disabilities. 7. Psychological factors. People with psychological disorders, like anxiety or chronic stress, use a higher amount of oxygen in times of distress. This can lead to the emergence of symptoms like shortness of breath, palpitations, or confusion. 8. Climate. Some environmental conditions, like extreme heat or cold, will require higher amounts of oxygen to maintain metabolism and other normal bodily functions. This can increase your risk for hypoxia.